One of the most common, and most misunderstood, concerns men bring into my clinic is this: "Doctor, why is my semen volume so low? Is it affecting fertility? Does it matter to your partner? And can you actually increase it, or is that just internet hype?" I'm Dr. Reena Malik, urologist and pelvic surgeon, and today I'm breaking down exactly how semen is made, what's normal, what's not, and the one proven method that truly increases semen volume. Stick around, because most men get this completely wrong. What semen is really made of. Most people assume semen is mostly sperm, but that's not true. In fact, sperm makes up only about 5% of total semen volume. The majority comes from accessory glands. The prostate contributes around 20 to 30%, producing fluid that helps nourish and mobilize sperm. The biggest contributor is the seminal vesicles, responsible for 60 to 70% of semen volume. These small sac-like structures store nutrient-rich fluid that makes up most of what you see during ejaculation. Even tiny bulbourethral glands add a small amount right before ejaculation. Why ejaculation force is different for everyone. Have you ever wondered why some men have a strong, forceful ejaculation while others notice more of a dribble? That difference comes down to pelvic floor muscles, especially the bulbocavernosus muscle surrounding the urethra. During ejaculation, this muscle contracts rhythmically to propel semen forward. Stronger, well-coordinated muscles create more force, while weaker muscles reduce projection. Importantly, force and volume don't reflect masculinity or fertility, they simply reflect muscle function and coordination. Does low semen volume actually matter to partners? Many men worry that low semen volume could harm their relationship, but the data tells a different story. A 2018 study surveyed 240 women about their partner's ejaculation and sexual satisfaction. The majority reported that semen volume or force did not matter to their pleasure. Only 17% said their orgasm felt stronger if their partner's ejaculation was noticeable, and just 13% linked it to self-esteem concerns. In short, if both partners are satisfied, volume is rarely an issue. Why semen volume decreases over time? Semen volume naturally peaks in a man's 30s and slowly declines with age. This can be due to muscle weakening, hormonal changes, lifestyle factors like smoking, hydration status, stress levels, and even medications. Day-to-day variation is also normal. However, a sudden or persistent drop may signal a medical issue, such as low testosterone, ejaculatory duct obstruction, diabetes-related nerve damage, or medications like tamsulosin that cause retrograde ejaculation. When you should see a doctor. If you notice a sudden, lasting change in semen volume, especially paired with dry orgasms or cloudy urine afterward, it's time to see a urologist. Conditions like retrograde ejaculation cause semen to flow backward into the bladder. This can be linked to prostate medications, diabetes, neurologic disease, or spinal injuries. Early evaluation ensures nothing serious is missed and helps guide proper treatment rather than guessing or relying on supplements that lack evidence. For ways to increase semen volume, the last one is proven. There are 3 habits that may help modestly: quitting smoking, staying well hydrated, and strengthening pelvic floor muscles with proper Kegel exercises. But the most proven method is ejaculating less frequently. Studies show semen volume increases about 10% per day of abstinence, with peak gains over the first 4 days. More time between ejaculations allows the seminal vesicles to refill. Supplements claiming miracles aren't FDA approved, patience actually works better. If you learned something new today, make sure you subscribe to the channel for science-based sexual health education without the myths or fear-mongering. Share this video with someone who might need real answers, and as always, take care of yourself, because you're worth it.